I'm going to go to the patient's chart and show you how quick and easy it is to do a therapist note within ICANotes and how you can complete notes in less than 2 to 3 minutes. So as I go to the therapist note part 1, let's pretend our patient is coming back to us today. We've been following up with her for several weeks and she has depressive symptoms, but they have gotten better in some areas. So I'm going to say the client has symptoms of depression. Using a left to right workflow, top to bottom, I'm going to say that depression is present and the frequency is it's episodic, it is daily, and the mood lasts for hours. And now I'll go through symptoms. And I'm going to say that the crying spells are much better, that concentration issues are about the same, fatigue has actually become worse, irritability is absent, sadness is present, and feelings of worthlessness are much better. As far as suicidality, the patient's not suicidal anymore, and her denial is convincing. I'm going to move over to behavior, and we'll go through self-care. I'm going to say that's slightly reduced. Her functioning at work has been impaired. Her substance use has been a little bit more than advised, and that social behavior is isolated due to COVID. As far as verbal content, our client today has problems in her relationship, and so we're going to talk about the relationship problems, depression, and some low self-esteem that has come from those issues. As far as therapeutic interventions, we'll go in and talk about our session goal, which is going to be focused on self-esteem and coping skills. I'm going to talk about interventions there. We're going to give Miss Piper Chapman support, encouraging her to vent her feelings. And then we could go in and counsel a little bit about the importance of abstinence with her alcohol consumption. Now we're going to go into the mental status exam, and I am going to say that today she's somewhat flat, she's a little disheveled, and she is somewhat unhappy during our assessment. Her speech and language are normal. Her mood is depressed, and I can talk about what that looks like as far as her body posture and attitude and facial expressions and general demeanor. Then I can go into her affect and say that she's also blunted in her affects. As far as the mental status exam, I can go as far in depth as I would like, or I can hit the highlights. It's like that with all the notes. You pick what you want to talk about in your patient's assessment. Now, as far as psychosis, I'm going to say she's not psychotic, she's not suicidal, she's not homicidal. Now, I can go back to part 1 and I can go and place in rating scale. So I can do a PHQ-9 and say that she has moderate depression. She scored an 11 on that PHQ-9. ICANotes will actually trend out your assessments. I can also justify level of care, justifying why I need to see this patient more. I'm going to say outpatient is still needed because it interferes with her day-to-day activities and she is unable to self-alleviate. I can also put custom buttons in. I'm going to say this is a return visit. So I can put the patient's name in to make it individualized. I can write whatever sentence I would like. And I can keep this custom button all to myself by keeping it private. I can share with select users. And then I could come in and share with select disciplines or the entire group. It's completely up to you. I'm going to keep this button private and call it my return visit in 1 week. I hit continue, and there you'll see the button will appear. I can click this button and it says Miss Chapman will follow up in 1 week. The wonderful thing about these buttons is I can put them in a specific order, and this button will be in every patient's chart. And so if I'm in Brad Pitt's chart, it will show up that Mr. Pitt or Brad will follow up in 1 week. And you can customize your sentences and even create multiple variations. So as you can see, I have 3 variation boxes. Again, this makes charting very efficient, very effective, and very fast. Now I'm going to move into part 2. You can easily enter a diagnosis in ICANotes using our shortlist. You can enter your service code, and I can even link to a treatment plan within ICANotes. So I can say my former treatment plan that I did was on depressed mood. And then as you can see, we have interdisciplinary treatment plans within ICANotes with multiple team members. But I can just select my intervention that I'm using for that short-term goal. As far as a self-report scale, I link that immediately into my note from her exact treatment plan, and I can say that she's doing really good here, and we're going to continue this current plan because we've seen some progress. And what you'll see is when I save this, we have a very beautiful note that I can have the patient sign. I can change the note title. I can create clinical summaries off of, and I can electronically sign this and even request co-signatures here.